700 deaths a day from medical mistakes. New research shows that's how many Americans are dying due to medical errors.
The I-Team's Courtny Gerrish looked into malpractice deaths in Wisconsin and talked to victims who say state laws make it nearly impossible to right the wrongdoing.
Courtney.
Yeah, according to new research led by Johns Hopkins, medical errors claim more than 251,000 lives a year, making it the third leading cause of death behind heart disease and cancer. And if medical malpractice happens in Wisconsin, many people affected are blocked from seeking justice because of laws and court rulings.
His heart was racing. He's dripping sweat.
Pat Madden-Rip's husband died 5 years ago from a general staph infection not caught by UW Health doctors.
You trust so much that they're going to be thorough and do what they need to do.
One of the two doctors who treated Floyd Rip twice was reprimanded. The Wisconsin Medical Examining Board found Dr. Mon Yi engaged in unprofessional conduct and fined him $935. Left to take care of their farm in Rio alone, Pat looked into filing a malpractice claim but couldn't find an attorney to take the case.
And a lot of them said, no, we don't take UW cases because the cap is so low.
Wisconsin has limits or caps on what people can collect for non-economic damages like pain and suffering. For UW doctors, it's $250,000. For any other doctor in the state, the limit is $750,000.
I mean, I gave her a hug and a kiss on the cheek, and I just said, I'll see you when you get out.
Rose DeLeon's mom died in January after surgery on her spinal cord. She's still waiting for an official cause of death, but Rose feels the doctor made a mistake, and she can't do anything about it. In addition to the cap, state law only allows spouses and minor children to sue.
It's all kind of pooled into just anger, and I can't do anything with it.
Over the last 17 years, medical malpractice lawsuits in Wisconsin dropped more than 50%, even though the state-run malpractice insurance fund sits at $1.2 trillion. Created in 1975, doctors pay into the fund, which gives them additional malpractice coverage on top of their primary insurance. Experts say this keeps malpractice premiums lower in Wisconsin, which helps attract physicians to the state.
It's out of balance.
Many trial attorneys like Daniel Rotier say the system in Wisconsin is broken. Rotier's firm rarely takes on medical malpractice cases anymore because of the limits on rewards.
They're only paying out around $15 million a year right now for claims. And there comes a point where this grand bargain of protecting doctors, limiting patients, has gotten so out of whack.
One death from medical error is too many.
But Dr. Don Dexter with the Wisconsin Medical Society points out big changes have been made to reduce medical errors and says it's nowhere near the third leading cause of death in Wisconsin.
The number of hospital admissions went up 11%. The number of deaths fell 8%. So we're doing something right.
I still struggle a lot.
Pat now has grandchildren, a life event her husband never got to experience. She continues to hope for a better system for victims.
There should be accountability and there should be some changes made.
About 35 states have some sort of damage caps like Wisconsin, but our state consistently ranks as one of the lowest when it comes to paying out on medical malpractice claims.
Okay, so this new research ranks medical errors as a leading cause of death, but the doctor you talked to doesn't agree?
He doesn't. Dr. Dexter with the Medical Society says it is a relook at older data and calls the definition of medical error researchers used overly broad.
All right, thank you, Courtney.
All right.